Well, if you've been dealing with hand, wrist, or shoulder pain, you are not alone, and the best part is you don't have to live with it. Today, we're chatting with Dr. A.J. Julka from JIS Orthopedics to break down what symptoms to watch for and the latest treatment options available. A.J., it's very nice to meet you.
Nice to meet you.
So first, let's talk about a very common carpal tunnel syndrome. What are the symptoms when you deal with that?
Carpal tunnel syndrome is a really basic condition not a lot of people know a lot about. So it is a nerve compression. So if you think about sciatica is a really common thing which people know about. They say, hey, I had a lumbar disc, it ruptured, I got this nerve compression in my leg, and now I have numbness, tingling, pain shooting down the back of my leg. So carpal tunnel syndrome is the same thing, but you're getting it in your wrist. You are getting a nerve compression at your wrist, and that nerve compression is going to cause issues like numbness, tingling in the fingers. Sometimes, classically, it's these three. It's your thumb, index, and long finger. It can be the entire hand. Strangely enough, you can get pains radiating from the hand, just like pinch nerve radiates down your leg. Pinch nerve can radiate up your arm to your shoulder, your neck. So people can get all different types of symptoms. One of the most common is, hey, I can't sleep at night because I fall asleep. My hands go numb, they burn, they tingle, they're sore. I have to get up, I have to shake my hands out or physically walk around, put them in warm water. So that's some of the most common symptoms people have when they come to us.
And there are two things you kind of operate with. It's the open and endoscopic carpal tunnel release. What are the difference between those two?
Yeah, it's interesting. I mean, we're always looking for the latest and greatest technology, and endoscopic carpal tunnel release is only about 30 years old. Yet, very few people do it. So interestingly, a carpal tunnel release is cutting of the ligament that is currently compressing your nerve.
That's causing the problem.
That's the problem. That's what you want to accomplish. You can cut through skin, fat, fascia, muscle, then ligament if you do an open release, which is a big incision in your palm. Or you could do it endoscopically where you use a camera and you go under the ligament and cut only one layer. And it would not take a rocket scientist to figure out which one is going to hurt more, which one is going to have quicker recovery, and what is just going to be less invasive in general. And it's the endoscopic approach is generally much less invasive.
Got it. And another issue people face is arthritis. Can you talk about what the symptoms are when it is that in the thumb or the hand?
Sure. And carpal tunnel can be confused with arthritis all the time. It's very common. Arthritic symptoms are going to be symptoms of loss of cartilage, so decreased range of motion, soreness, achiness, pain. Some patients will physically, particularly if they have arthritis of the thumb, they'll actually feel grinding. They will want to massage their hands all the time in that location, similarly to an arthritic knee or an arthritic shoulder. You can have swelling, and then it would be worsened by anything that puts pressure on it. So in the knee, it would be walking or running up the stairs. That would hurt your arthritic knee. In the hand, it's just use. So opening a Ziploc bag, pulling up your socks, you have to pinch and squeeze. Any of those kind of things are going to increase the symptoms of arthritis.
And when it comes to the thumb, what treatment options are available there?
So it's not always surgery. We see people in all different stages. So some are, hey, it just started hurting. I want to know what this is. That is education only, right? Education, share them the x-rays, what is going on, what you should and shouldn't do. This is not something that you're going to exercise your way through. You're not going to grip and make it stronger.
That's good to know.
That would actually make it worse. Second-rate options are splints, which we provide, or people can get them off Amazon. You can also do cortisone injections, which decrease inflammation within the joint. For some patients, those can be miraculous. I have some patients where it helps them for a year or more. And if it's a 30-second treatment that's simple and non-invasive, helps for a year, that's a no-brainer. There are some other patients where either the injections don't work, or they say, I've had 5 and now they've stopped working, or I call them the farmers, which is patients who come to the doctor only at their hand is falling off, now they're going to come to the doctor. So they're there for surgery. And some of those patients, we really don't bother with all the other treatments because they're at the end of the rope, and then there is an excellent 30-minute surgical procedure that works very, very well.
So many options, and I know we're out of time now, but if people want to reach out to find out what works best for them, how do they go about doing that?
So they would just go to jisortho.com, or they would find me directly on the internet.
That's great, and I know we've been to your offices. We'll be there soon, and once again, AJ, thank you so much. The directions are right there on your screen, jisortho.com, 614-221-6331.